Well, for more on the Wuhan virus outbreak, we're joined by Dr. Daniel Lucey, and he's the Adjunct Professor of Medicine and Infectious Diseases at Georgetown University Medical Center. Dr. Lucey, thank you very much for joining us today. So, as you well know, the authorities in China are taking preemptive measures here and imposing a quarantine on the city of Wuhan, a city of some 11 million people. That's not any small number, as you know. How effective do you think that this will be in curbing this spread of the virus?
Well, thank you for having me on your show. I certainly hope that it's effective, but we really don't have much precedent to go on because such action hasn't been taken previously. To my knowledge, in China, didn't happen during SARS, for example. Hasn't happened in the United States for any infectious disease outbreaks. There was this much smaller scale example during Ebola in West Africa in Monrovia, the capital of Liberia, in August of 2014, when a specific area of the city was put under a quarantine, if you will, or a cordon sanitaire, as it used to be called in the French. And unfortunately, that didn't end very well because unlike it sounds like China, they weren't providing enough water and food for people. And so there was an immediate rebellion, and a teenager was shot and killed by the army. So I think this is a very different situation. For one thing, it's much bigger scale. And it's really unprecedented. We hope that it's going to be effective, but already, as you mentioned, the virus is in many other provinces and large cities in China.
Right. And in your opinion, should we be concerned about the rate at which, of course, a number of people are getting infected and also the deaths increasing?
Well, I think certainly we should be concerned. The number of deaths increasing. Honestly, to me, I've worked a lot of outbreaks in a lot of years, and I came to Hong Kong and Guangzhou and Toronto during SARS and all across the Middle East during the Middle East Respiratory Syndrome, MERS. Those are the two coronaviruses causing pneumonias before this one. And many of the patients, roughly out of the 450 or so that I know from earlier today, about 102 were in very serious condition. So I think that means that the Chinese medical workers are doing a great job to help people stay alive who otherwise, without intensive care, they would have already died. So I would predict we're going to see rising numbers of deaths in the coming days.
And Dr. Lucey, how concerned do you think we should be, given the fact that, of course, this has moved and it's now, from animal to human, now it's human to human transmission here, and the fact that the authorities have already acknowledged that, the virus is sort of adapting and mutating as we speak?
Yes. So again, I think it's a constant vigilance, not just by the day, but by the hour, really. And I think that's what's being done. And the virus does seem to be becoming more transmissible, more easily spread between people, at least than we were told early in the month, when there were only about 41 cases and then 45 and also much larger numbers. But I think that's partly because a diagnostic laboratory test became available after the very rapid discovery of this virus over maybe 8 days. It was an incredible success story by the Chinese scientists. So they developed a rapid test, which then can be used in developed as well in Singapore and in Japan and the United States and a lot of places. That's how you diagnose the patients. So I think this big increase in number of patients is partly because they were able to start testing for them, because this pneumonia looks just like most other pneumonias or even a really bad flu. So you have to do this specific diagnostic test. So that said, for me, it's very worse in that now there's several hundred people in Wuhan. So if they keep on testing, maybe you're going to find more and more. So I'm worried that it's spreading in the community, in the city of Wuhan, 11 million people, or maybe 19 million, including the outer area. So I'm just afraid it's going to start spreading like that in Guangdong or in Beijing. And then what are we going to do? What's going to be done? You can't quarantine all of those large cities. I mean, many cities in China are much larger than New York City, say, or Los Angeles in this country. So
yeah,
it's a very challenging time now, historical.